Orders of the day.
3, MPP Stiles.
I recognize the Leader of His Majesty's Official Opposition.
Thank you, Speaker. I move the following motion. Whereas hospital infrastructure is vital to protecting the health of the public and in strengthening Ontario in the face of economic uncertainty, and whereas the government has identified priority nation-building infrastructure projects but failed to include any healthcare infrastructure, and whereas there are significant hospital infrastructure projects which have experienced long delays and funding cuts under Liberal and Conservative governments, and whereas hospital infrastructure improvements create good union jobs for construction tradespeople, and whereas hospital expansions create good union jobs for healthcare workers, therefore, in the opinion of the House, the government must designate critical hospital infrastructure as nation-building projects and fund them in the 2025 budget, including specific commitments to new hospitals for Durham Region, Brantford, Kitchener-Waterloo and Brampton, reopening the Minden Hospital, expanding the Windsor-Essex Regional Hospital, Queensway Carleton Hospital, Arnprior Regional Hospital and Hamilton Health Sciences, redeveloping the Winnebago General Hospital and Health Sciences North, renovating the Thessalon Hospital, Matthews Memorial Hospital, Manitoulin Health Centre, and Red Lake Margaret Cochenour Memorial Hospital, and restoring 24/7 emergency services and urgent care to Welland Hospital, Douglas Memorial, and Port Colborne.
MPP Stiles has moved Opposition Day motion number 3. I recognize the Leader of His Majesty's Official Opposition.
Thank you, Speaker, and good afternoon, everyone, and thank you. Across Ontario, people are doing their part. They're showing up for each other. They're working hard to build a strong future here in our beautiful province. But when they walk into the emergency room, they're told to wait. When they need surgery, they're told they have to leave town. When they ask for help, they're told, not yet. Hospitals are crumbling. Urgent care and emergency rooms are closing. Communities have been waiting for too long. That's why today we are putting forward a motion to build, care, and strengthen Ontario. We are making hospital projects across the province nation-building projects. New hospitals for Brampton, Durham, Kitchener-Waterloo, and Brantford. Reopening the Minden ER. Expanding care in Windsor, Hamilton, Niagara, and all across the north. Renovating hospitals in Red Lake, in Manitoulin, in Thessalon, and in more. Restoring 24/7 urgent care in Welland and Port Colborne and Fort Erie. These are life-saving, job-creating, shovel-ready investments. Speaker, let's build care and strengthen Ontario. You know what? Sit down. Yeah. There's a very tall member across the way. He likes to stand in the camera when I'm speaking. I've noticed it a number of times. I would appreciate if you didn't do that anymore. Okay? Yeah. Yeah. Speaker, last week we learned Ontario's manufacturing sector is facing the sharpest decline in the country. That's now 33,000 manufacturing jobs that are being lost under this government. In Windsor, unemployment is spiking. In Oshawa, GM is cutting shifts. In Thunder Bay, Alstom workers are facing layoffs again. And the Premier's response? Wait and see. Ontario workers don't need a Premier who crosses his fingers and then just waits to see what's coming. They need a plan, they need a path forward, and they need a government that actually shows up. That's what it means to strengthen Ontario. Hear, hear. As the official opposition, that's our focus every single day. Speaker, a few months ago, the Premier pulled US-made alcohol from LCBO shelves. It was to send a message, and you know what? I supported that. But now, Bacardi's back, right? With no explanation. Speaker, if you want to show strength, act like it. The Premier needs to pick a lane, because mixed signals are not sending the right message. They're weakening it. Now, if this government wants to send a message, here's another one that they could use to get started with. They could get people vaccinated. Speaker, it's 2025 and we are in the middle of a measles outbreak. Over 1,300 confirmed cases, the worst we have seen in decades. We're now outpacing the United States in a disease that we know how to prevent. Dr. Robin Lennox, our MPP in Hamilton Centre, has been raising the alarm from day one, calling for clear public communication, a province-wide education campaign about the free MMR vaccine, and a coordinated strategy with public health units. We have seen how fast misinformation can spread, Speaker. We need to meet it with urgency and clarity and fast action, because when public health is at risk, there is no time for wait and see. So let's work together, let's protect our communities, and that's how we are going to strengthen Ontario. Now, Speaker, this government says it wants to invest in nation-building infrastructure. But here's the reality. They're pushing forward with a $100 billion tunnel, while hospitals across Ontario are stuck waiting. You want to build something that strengthens Ontario? Then build hospitals. Build urgent care centres. Build the infrastructure that people are counting on, from Brampton to Ottawa to Windsor to the north. Don't chase vanity projects. Fund the services that actually save the lives of people right here in the province of Ontario. Speaker, this motion, although it lists a lot of projects, it isn't just about a list of projects. It is a blueprint for a stronger Ontario. These hospitals have been studied. They have been planned. They have been promised. Some are shovel-ready right now. Some are long overdue. All of them are needed right now. Because when you build care, you don't just shorten wait times, you give people peace of mind. You create good union jobs. You strengthen local economies, and that is how we build a province that's ready for whatever is coming next. Speaker, this motion is a test of our priorities. If you believe that a sick child in Brampton deserves a hospital bed, support this motion. If you believe a laid-off worker deserves a job building care, support this motion. If you believe Ontarians deserve a government that meets the moment, support this motion. Let's build care, let's strengthen Ontario, and let's get the job done together. Thank you, Speaker.
Further debate? Further debate? Recognize the member from Etobicoke Lakeshore.
Thank you, Speaker, and I'm pleased to speak to this motion today. Hospitals are an essential part of our public health care system. I've worked in healthcare for 27 years at Princess Margaret Hospital, part of the University Health Network, and most recently at CAMH. I also had the privilege of serving as the president of St. Mary's Hospital in Kitchener, a job I started in January 2020, just 9 weeks before our world changed as we experienced the global pandemic and lockdowns to protect lives, and our hospitals from becoming overwhelmed with severely ill and infectious patients. St. Mary's Hospital infrastructure dates back about 100 years, and it showed. Throughout my tenure, I worked with our board of directors, community leaders, including local members here, to advocate for funding to build a new, modern, larger hospital, combining the programs of St. Mary's and Grand River Hospitals. It was the last announcement made under my tenure, just before leaving to run for office, and we had made a clear case for change. There's actually very good data available to inform the choices on hospital redevelopments and communities most in need, where there's population growth, where repairs are too costly, or the buildings are getting beyond ability to repair, where there's still tiny 4-bed rooms with shared bathrooms that you can't even fit a walker through the door of. The government's job is to be systematic in picking hospitals based on objective criteria. And I think it's important that the current government should take that very seriously too. I know, for example, the redevelopment of Grand River Hospital and St. Mary's Hospital as a large joint project met these criteria, and it was well recognized that it was needed. Trillium Health Partners, a big redevelopment, was a project started under the previous Liberal government and now continues by this one. It's another example of a community in desperate need of expanded hospital services. I recall in one of my previous roles, I visited many hospitals back in 2019 to look at the state of hallway healthcare. And I recall one hospital that was in a community that so desperately needed more capacity. So appropriately, it was funded and moved forward. Given the population growth and the long capital project wait list, it's important that these hospitals, like the one in Kitchener-Waterloo, move forward and the work gets underway. Whether a nation-building project or not, these investments are needed. I appreciate this bill comes forward to signal it's an opportunity to ensure that these projects progress at pace. But the reason I ran for public office was not because we had an old hospital. It was because under this government, I saw a loss of transparency and accountability, and our public health system weakened. We lost a view as to how our system was performing, where attention needed to be paid, while I saw our public resources redirected to private benefit that cost our public payers more without accountability on outcomes. One example of this was Bill 124. Today it is the first day of Nurses Week. Nurses get into nursing because they care. They want to make it better. This bill, now deemed by the courts as a violation of charter rights, tied the hands of every hospital in Ontario to be able to appropriately reward nurses during that period. And to no one's surprise, nurses capped at a 1% wage increase felt disrespected and unvalued, and too many left when we needed them most, and some to private nursing agencies. Like most hospitals, we had no choice but to fill that gap with private agencies that cost significantly more, who were happy to make a profit from public dollars at a time that we were the most in need. It was almost as if it was all by design. The government decided to only provide funding for about 75% of those wage settlements. Meanwhile, our public hospitals are now expected to find a way to fill that gap, and many had no choice but to make cuts in services, including emergency departments, that rarely happened before 2018. These closures come at a time of crisis in primary care, with record numbers of people without primary care. More are forced to turn to emergency departments. And even on primary care, we're seeing announcements this week, but in 2018 we had over 90% attachment, which means that people had access to primary care, and that has significantly dropped off. The nation-building project that started 6 decades ago is public health care. And that is the project I believe most Canadians and most Ontarians support. And it is what I heard on the doorsteps thousands of times this past election. Yes, we need hospitals, and we need stable funding to run them. We need our workforce to be valued and respected, and we need the other parts of the systems, primary care, home care, long-term care, mental health care, and prevention to be properly resourced. We need it to be strategic. These are not insurmountable challenges, and they require a government to make deliberate choices to support them. Our public health care system isn't just a collection of policies and buildings. It's a profound expression of Canadian values. We value fairness, compassion, and the dignity of every person. And the people of Ontario deserve nothing less than a healthcare system that honours these fundamental Canadian values. And I urge this government to respect those values. Thank you.
Further debate? Further debate? I recognize the member from Hamilton Centre.
Thank you very much, Speaker. And so I would like to start by recognizing that this motion is meant to support our publicly funded healthcare system. The thing that in Ontario we should all be wanting to reinforce, to strengthen, because it serves all of Ontarians. And just the weekend before last, I was doing a shift in hospital covering for a colleague. And as I walked in, I walked by the emergency department to see my patient, and I walked by a hallway in the emergency department that was stretcher and stretcher and stretcher and stretcher. So many that we now know exactly how those stretchers are labeled in the hallway so that we can find our patients. We also now have terminology SR for our patients, for sunroom, because we always have patients sitting in our sunrooms to be seen, trying to sleep even though the windows are blaring. We also now know what it is to see patients often with cognitive impairment having to sit permanently by the nursing station because there's no quiet room for them to be in to get the attention they need. And so they're sitting in the nursing station among all of us doing our charting because that is the only place for them to be. This has become normal, but it shouldn't be. It is extremely abnormal, and it is different than how it was when I was practicing 7 years ago. And we know that in Ontario, our health system has been intentionally strained and intentionally underfunded. And despite hearing that ending hallway healthcare is a priority, we know that there's been no meaningful change under this Conservative government. And despite healthcare being our largest budget item, we in Ontario still spend the least per capita on healthcare of any other province. In addition to that, we know that we have less than half the hospital beds that we had 30 years ago. But that doesn't mean that less people are ending up in hospital. And so I commend the effort of our caucus to try to promote the need for increased hospital investment, increased hospital infrastructure, reopening services that have been closed, because we know that people turn to hospitals in their time of greatest need. And the worst thing that can happen to someone is to show up at a hospital door and to see a closed sign and to be told to keep driving to try to find help somewhere down the road. And that has become our new normal. So thank you, and I look forward to hearing more about this motion.
Further debate? I recognize the member from Nepean.
Thank you, Madam Speaker. Let me begin by saying this. I wholeheartedly agree with the spirit of this motion. Ontario must treat hospital infrastructure as a priority. Our province is growing, our population is aging, and the wear and tear on our healthcare facilities is undeniable. As a frontline nurse at the Queensway Carleton Hospital in Nepean, I see every single day the human cost of our crumbling hospital infrastructure. We are past the point of asking whether hospital infrastructure is vital. That's a settled question. Hospitals are where life begins and too often where it ends. They are where Ontarians go in moments of crisis and vulnerability, trusting that help will be there. But increasingly, we are pushing our hospitals to their limits and the people who work inside them to a breaking point. We've seen this government roll out a list of their priority projects like a fantasy tunnel in Toronto or a luxury spa at Ontario Place. I'm not fully understanding why this is the focus for this government while our hospitals are overcrowded, our ERs are literally shutting down, and our aging facilities aren't able to keep up with increased demand. At Queensway Carleton Hospital, which serves one of the fastest growing populations in the city of Ottawa, we are well beyond capacity on a daily basis. Our emergency department was built to handle about 60,000 patient visits a year. Last year, we saw nearly twice that number. Patients are being treated in hallways, stretchers are lined up in waiting rooms, and we, the nurses, doctors, and staff, are expected to make it all work in the same space with the same aging infrastructure and fewer resources. And let me be clear, I am proud of what we do for our patients at the Queensway Carleton Hospital. Our resilience speaks volumes, but it shouldn't be that way. The current conditions of hospitals throughout Ontario are unsustainable, and they are frankly unsafe. Hospitals across this province are literally falling apart, and yet this government doesn't seem to care. Last week, I asked the Health Minister if she would commit to investing and funding the much-needed expansion of the Queensway Carleton Hospital emergency room. A simple yes or no question. to which she refused to answer. And what message does that send? It tells Ontarians that our health doesn't matter, that access to emergency care doesn't matter, that the dignity of patients and the well-being of frontline workers doesn't matter. But we know that this isn't true because hospital infrastructure does matter, not only to healthcare delivery, but to our economy. Investing in hospital expansions creates good, family-sustaining union jobs for construction workers, for tradespeople, and for the next generation of skilled healthcare professionals. Every crane in the air is a signal of hope. Every new bed opened is a promise fulfilled. We have shovel-ready projects ready to go. We have aging facilities desperate for renewal. We have communities in crisis. What we don't have is the political will. This motion calls for long overdue action in places like Durham Region, Brantford, Kitchener-Waterloo, and Brampton. It calls for expanding the Windsor-Essex Regional Hospitals and Queensway-Carleton Hospital, my hospital, where every additional square foot means better care, faster treatment, and safer working conditions for staff. As I said, I'm supportive of this motion, and I'm thrilled to see the Queensway-Carleton in the list. I do wonder, though, why certain hospitals were left out. For example, where is the Kingston General Hospital listed? A hospital that serves not just Kingston, but the entire southeastern Ontario region. Its aging infrastructure requires modernization to meet today's demands, and yet it wasn't mentioned. So I'm just curious why. It's not enough to just name some hospitals in some regions. If we're serious about building a strong healthcare system, we need a framework that prioritizes need, capacity, and regional equity. This isn't just a to-do list, it's a moral obligation, one that we owe to every patient who waits too long for care, to every family who drives hours for a hospital bed, and to every nurse or doctor who burns out trying to do more with less. And let me tell you what not investing looks like. It looks like nurses leaving the profession. It looks like hallway medicine becoming the norm. It looks like delayed surgeries, canceled appointments, and patients dying from preventable deaths. As a nurse, I can tell you this: no amount of training can make up for a system that's physically broken. I urge every member in this House, regardless of party affiliation, to seriously consider this motion. It is a question of what kind of province we want to live in. One where your postal code determines your access to care, or one where every Ontarian, north or south, urban or rural, can count on a strong, modern, well-staffed hospital when they need it. We can't fix hallway medicine without fixing the physical capacity issues. We can't recruit and retain healthcare workers without giving them the facilities they need to do their jobs safely. And we can't call ourselves a strong, prosperous, nation-building province while our hospitals fall into despair. So let's stop pretending that the only infrastructure that matters is roads and bridges. It means hospitals and hospital beds. It means MRI machines. It means emergency departments that stay open. It's time we invest in hospital infrastructure and show the people of Ontario that their public healthcare system is not negotiable. Thank you.
Further debate? I recognize the member from Bay of Quinte.
Thank you very much. Thank you, Madam Speaker. Before I begin today, I just want to say to my colleagues on the other side of the House, if any of you, for any reason, need to stand up, stretch your legs, visit a neighbour, feel free. It is an honour to speak about a topic that is crucial to the well-being of our communities and the future of our province: hospital infrastructure. As we navigate the complexities of modern healthcare, it is imperative that we invest in and enhance our hospital infrastructure to meet the growing needs of our population. Under the leadership of Premier Ford and Minister Jones, our government is making capital investments across the province so we can sustainably support the healthcare needs of Ontario, just like in my home riding of Bay of Quinte with our new Prince Edward County Memorial Hospital, state-of-the-art $200 million mass timber build. We cannot wait for that hospital to be completed. Thank you very much. These investments mean more hospital beds in communities, more diagnostic testing like MRIs and CTs closer to home, and more skilled healthcare workers to provide care. Our government is building a convenient and connected healthcare system that puts people first. That is why Ontario is delivering on the most ambitious plan for hospital expansion in the province's history. Ontario's plan will lead to investments of nearly $50 billion over the next 10 years in health infrastructure, including close to $36 billion in capital grants. This includes supporting more than 50 hospital projects that would add approximately 3,000 new beds over 10 years to improve access to reliable, high-quality care. For example, Durham Region is experiencing significant population growth with a rising level of alternative level of care, or ALC rate. Addressing these pressures is essential to ensure that residents receive timely and effective health care services. Among our approved projects is the hospital redevelopment project at Lakeridge Health's Bowmanville site. Planning and design work is currently underway for the Bowmanville redevelopment, and in summer 2024, Infrastructure Ontario initiated the process to select a team that will be delivering this project. The Ministry of Health continues to work closely with Lakeridge Health and other partners, such as Ontario Health, to determine how the hospital's short-term and long-term program and service needs can be met in alignment with capital planning needs. To date, our government has provided more than $12 million in capital planning grants to support Lakeridge Health's master planning, including the Bowmanville redevelopment project. It is important to note that planning for major capital projects like Lakeridge Health's proposed new hospital is a complex process to address the health service needs within that community. Our government is supportive of Lakeridge Health's plan for the future, involving a multi-phase redevelopment that will ensure families across the Durham region can access the care they need when they need it. The plan includes redevelopment of hospital campuses across the region, as well as a new hospital site in Whitby that will expand services and add more beds to connect more patients and their families to convenient care closer to home. Ontario will continue to work with Lakeridge Health as it moves forward with its plan and continues planning for the site of its proposed new Whitby Hospital. To support the early planning work for its master plan, a total of $2.25 million was approved as a planning grant by the ministry. Lakeridge Health is planning expansion of its services and hospital campuses to add new hospital beds and enhance services throughout the region, including redeveloping the Bowmanville Hospital by adding up to 32 new beds and building new facilities to expand inpatient and ambulatory care services and the emergency department. Planning for a new post-acute care centre in Pickering, and creating space for acute care capacity at the Oshawa site by relocating some services to a new post-acute care centre in Pickering. Later phases of the redevelopment plan under consideration include expanding the Ajax Pickering Hospital to connect more people to clinical and support services. Earlier this month, our government broke ground on an expanded emergency department in Renfrew County. The largest redevelopment in St. Francis Memorial Hospital's history in Barry's Bay will connect more people to quality emergency care close to home. Once opened, the new state-of-the-art emergency department will accommodate an estimated 11,900 visits each year and will include a dedicated isolation room equipped with negative air pressure to keep patients safe by preventing the spread of airborne infectious diseases, a new entrance for ambulances to use, improving patient flow, quiet room space for mental health patients and families, an upgraded trauma area to ensure timely responses to emergencies, and improved infection prevention and control measures. Because our government understands that when someone experiences a medical emergency, it is vital that they get the urgent attention they need quickly. That is why we are investing an additional $44 million this year in 165 high-volume and smaller emergency departments to reduce wait times and provide people with faster and easier access to timely care close to home. This funding is in addition to the $90 million that our government invests each year to reward emergency departments that put in place innovative solutions to reduce emergency department wait times, including hiring additional healthcare staff, accessing more transportation to help transfer medically stable patients out of emergency departments, and by creating new beds. We know that emergency departments have faced capacity pressures. That is why our government has offered a range of initiatives to support rural and northern hospitals. The Northern Ontario Resident Streamlined Training and Reimbursement Program, or NorthStar, enables medical students to provide immediate and longer-term physician support to Northern Ontario communities. The Ontario Health Emergency Department Staffing Stabilization Strategy is a joint Ministry of Health and Ontario Health Nursing Action Plan to stabilize ED nursing coverage by investing $4.7 million to bolster and stabilize the emergency department nursing workforce through emergency department training initiatives and the establishment of clinical leadership and support by hiring regional emergency department educators for on-site nursing in education hospitals. The Community Commitment for Nurses program offers nurses a $25,000 incentive in return for a 2-year commitment in areas that need nurses the most. The Supervised Practice Experience Partnership offers internationally educated nurses the opportunity to meet their evidence of practice and language proficiency requirements to achieve their nursing license. The Enhanced Extern program also offers employment opportunities in hospitals to clinical learners such as nursing and medical students to work in an unregulated capacity as externs. The Nursing Graduate Guarantee funds employers to provide new nurses, including those who studied out of province and abroad, with temporary full-time employment above employer staffing complement. Over $76 million has been funded to nearly 60 healthcare organizations and employed up to 2,200 new nurses in 2023 and 2024. The Temporary Fee Reimbursement Program reduces financial barriers to registration for internationally trained and retired nurses by covering application, examination, and registration fees. The ED Peer-to-Peer Support Program supports ED physicians through access to immediate on-demand coaching, mentoring, and support from a credentialed peer emergency department physician via virtual channels. The program initially launched as a pilot in October of 2022 across 6 emergency department sites and completed its pilot phase in December 2022. Following this, the program was expanded to 27 emergency department sites and then to every emergency department in the province by June of 2023. The Emergency Department Pay for Results program supports emergency departments that provide emergency care to fewer than 30,000 patients a year, so they can hire and retain the staff they need to keep their emergency departments open. And the Clinical Scholar Program was launched in June 2023 and supports both recruitment by and retention by creating membership opportunities. Through this program, experienced frontline nurses provide at-the-bedside mentorship and support to new graduate, internationally educated, or upskilling nurses to confidently transition into new healthcare working environments and nursing practice. This includes emergency department settings. In Orangeville, we are building new emergency and diagnostic imaging departments that will increase patient capacity and ensure the hospital is better equipped to deliver state-of-the-art care for patients and families now and into the future. Kim Delahunt, the president and CEO of Headwaters Healthcare Centre, said, "We are deeply grateful for the investment being made to renovate and expand our emergency and diagnostic imaging departments. This will transform patient care and experience at Headwaters and support the teams that work in these departments. It will enable us to continue to provide excellent care close to home for the rapidly growing population and patient volumes that we see in Dufferin-Caledon." And we recently broke ground on a new emergency mental health and addiction services unit in Guelph, Ontario. Once opened, Guelph's General Hospital's new mental health and addiction services unit will include expanded capacity in the short-stay assessment unit from 4 to 8 beds to monitor and treat more adult patients experiencing psychiatric emergencies. A new emergency follow-up service that will increase individual and group counseling services by 14% to help more than 2,200 patients stabilize before being discharged and reduce readmissions. A new walk-in inpatient intake zone. Additional ambulance capacity from 2 to 3 by building a new 3-bay ambulance garage with a dedicated offload area, reducing offload wait times in the emergency department. And a brand new reception area in the emergency department, including a new waiting room and triage area. Earlier this year, we celebrated the completion of a historic Cambridge Memorial Hospital expansion. The hospital's largest redevelopment project will connect more people to an expanded emergency department, surgical suites, and an intensive care unit. Our government invested over $220 million to support the project, which renovated and redeveloped over 400,000 square feet of hospital space to build a new inpatient care tower. This new state-of-the-art facility will increase the hospital's ability to care for more people by over 30% and improve care for patients undergoing life-saving surgery or requiring emergency care. And by expanding access to hospital care in Hamilton, Juravinski Hospital will become the largest inpatient facility in South Central Ontario, with more than 500 inpatient beds, and will help the region meet the needs of its growing population, making it faster and easier for people to connect to a range of specialized adult care and services. Tracy MacArthur, President and CEO of Hamilton Health Sciences, said, "The Juravinski Hospital will bring the hospital's nearly 100-year-old spaces into the 21st century. Our patients and teams expect and deserve nothing less than access to modern, accessible healthcare facilities to support world-class care. We are grateful for the provincial government's ongoing partnership and investment in this vital community health project." In November, our government announced that we are making it faster and easier for people living in Burlington, Ontario, to connect to high-quality, comprehensive mental health and addiction support services closer to home by building a new health unit at Joseph Brant Hospital. Our government's investment will build and create a larger state-of-the-art space for inpatient and outpatient services to ensure the hospital is better equipped to deliver timely and high-quality mental health and addictions care for more patients and their families in a safe and comfortable setting. In Kawartha Lakes, we are building an expanded emergency department at Ross Memorial Hospital that will include the creation of new state-of-the-art mental health emergency services unit. This expansion will improve patient safety and ensure the hospital is better equipped to provide timely care for mental health patients. This expansion will also include a new trauma room with improved infection control measures to provide emergency department staff with additional space to treat patients requiring life-saving care. At Joseph's Healthcare in Hamilton, our government is connecting more newborns and their families to better, more convenient specialized neonatal intensive care and birthing support through the redevelopment of the special care nursery. Through this redevelopment, the current special care nursery will be renovated to create a larger and more comfortable space to ensure that newborns and their families have better access to specialized neonatal intensive care and family-centered birthing supports, including enhanced infection prevention and control measures to ensure the health and safety of critically ill newborns, more private rooms to address privacy concerns and create lower stimulus environments for newborn patients, capacity to accommodate state-of-the-art design standards which provide more space for specialized care, a designated room to store pumped or donated milk, and other supports tailored to the early developmental needs of infants, including respiratory treatments, lactation, and nutrition supports. Those projects are just some of the many examples of the bold action that our government is taking to invest in our hospital infrastructure, supporting world-class healthcare facilities for patients, families, healthcare professionals, and communities. In conclusion, investing in hospital infrastructure is essential for the health and the well-being of our communities. It ensures that patients receive the best possible care in a safe and modern environment. Our government's dedication to investing nearly $50 billion over the next 10 years in health infrastructure is a significant step in the right direction. However, it is up to all of us to support these efforts and work together to build a healthier future for Ontario. Thank you for your attention, and I look forward to working with all of you to achieve our shared goal of a world-class healthcare system. Thank you.
I'd like to the member for Niagara Falls.
Thank you very much. I obviously support the motion, but I want to talk about Fort Erie and talk about Douglas Memorial Hospital. It used to be a 24/7 urgent care center, but this premier in Niagara Health decided to cut the hours down to 10 hours a day. Made absolutely no sense then, makes no sense today. 38,000 people live in Fort Erie. They rely on that urgent care center. But think about this, 12,000 of those residents don't have a family doctor. Wow. Where are they going to go? They can't go to the family doctor, and now they're cutting the hours in the urgent care center so there's no overnight. So they have to go to the emergency room either in St. Catharines or Niagara Falls. Our emergency rooms today are 12 to 19-hour wait time just to get in. It makes no sense, and the AG report was very clear, and these guys over here should listen. The AG report was clear. It said if you want to improve wait times in your emergency rooms, invest in urgent care centers, not cut them and close them. It makes no sense to me. And then I take a look at Fort Erie. I kind of break it down into families. You know that 60% of the people that live in Fort Erie are over 55 years old. A lot of them don't drive. There's no reliable transit. It makes no sense what this government's doing. So when they talk about investing in healthcare that's not happening in Niagara. And I want to talk about what happens at urgent care center. I'll give 2 examples. There's a gentleman that had a heart attack. He wouldn't have made it to Niagara Falls. He wouldn't have made it to St. Catharines. He made it to the urgent care center. And those doctors and those nurses saved his life. And they came and thanked that hospital for doing that. But he would have been dead. There's a young kid, 11 years old, had an appendix attack. And guess what happened? He wouldn't have made it to Niagara Falls. He wouldn't have made it to St. Catharines. But he made it to that urgent care center and saved his life. That's the difference when you have an urgent care center 24/7. It saves lives. Why do we have to every single day worry if I'm not going to get into an urgent care center because it's closed and I may die? Nobody should die in the province of Ontario, one of the richest provinces in this country, quite frankly, because they're not getting health care when they need it, where they need it, and why they need it. It makes no sense. And I'm going to finish by saying this. We heard today during question period very clearly they spend $1 billion in agency nurses. And they try to defend that. They say, oh, that's good. These are good nurses. We're not talking about the nurses. We're talking about the $500,000 to $600,000 of that money that went to a corporation or private company that's run by the Harris family. That's what we're talking about. And then we heard about Shoppers Drug Mart, $62 million. So I say to them, take that $1 billion, take that $62 million and put it into urgent care centers. Put it into the community of Fort Erie. That's what should be happening in healthcare today. Thank you very much.
I recognize the member for Ottawa South.
Thank you very much, Speaker. I just want to preface this by saying I'm going to support this motion, but I want to express some concerns about the motion. As I do understand that the Prime Minister has indicated that it could be a priority. And, you know, to be honest right now, I'm not sure we have a problem with building hospitals in Ontario as much as we have as to what's happening in hospitals here in Ontario. So I don't want to complain, but I would have rather seen that in the motion. The second thing is we're kind of picking winners and losers here. So Briere Continuing Care, which is in Ottawa-Vanier and in Ottawa Centre, is not included in that. It has one building that's over 100 years old, another building that's approaching it. They have a project. They've been skipped. They've been missed for years and years and years. So while I support what's behind the motion, I'm concerned, number one, that we've picked winners and losers, and we've excluded institutions, and not just in Kingston as well, too, right? So, you know, I think that's a concern. I think it's a valid concern. And the second thing is, the problem that we have right now is not building hospitals. These guys, it's easy. They like to build. That's what they do. They just can't get what happens inside right, and that's bad for people. Thank you, Speaker.
Further debate? I recognize the member for Parkdale High Park.
Thank you, Speaker. In 2023, just a few months before she died, I memorized my grandmother's hands. 102-year-old hands, so fragile, so petite, bony, and curled in the way all of our hands might go if we are lucky enough to live to be 102. I had hours and hours to study them after the ambulance delivered her to the hospital because St. Joe's emergency was full and we had to go to a new hospital, and we were placed, you won't be surprised, in a hallway to wait. And as she tried to get comfortable on a gurney, the sympathetic looks from the healthcare workers as they went by gave us some comfort as they moved away from her to serve or save some other life. These elderly hands, I thought, these hands that served as a bomb girl in World War II, these hands that helped to build a shelter for unwed mothers in Aurelia decades and decades ago, these hands that nurtured 4 children and 9 grandchildren and 7 great-grandchildren, they deserved more dignity, more compassion, more care than a public hallway in a hospital could give. So as we contemplate nation-building projects and what is primary to Canada, I can tell you it is not tunnels under the highway. Think Tommy Douglas and healthcare. Building up our public healthcare system, providing good union jobs to construction workers and to healthcare providers that will lead to caring for our loved ones when they are most in need. From the premature babies to our elders, this government is failing our families. And that is why it's time to include hospital infrastructure in the nation-building projects of this government. And so, in remembrance of my Nana, Speaker, and for the people of Parkdale High Park and St. Joseph's Health Centre, I'm going to vote in favor of this motion, and I'm going to invite and urge my colleagues across the aisle to think of whom they would like to dedicate their votes to.
Further debate? Further debate? I recognize the member from Spadina, Fort York.
Okay, thank you very much, Madam Speaker. It's, a real pleasure to be able to stand up and speak in favor of this NDP motion to reopen the Minden Emergency Room, to restore emergency room services in Welland and Port Colborne and Chesley, and to rebuild and build new hospitals and renovate the hospitals that we have across this province, and to do this as part of a nation-building exercise that we need to undertake because we are under economic threat from the United States. Because one of our biggest competitive advantages in Canada is our public health care system. In the United States, they spend $12,000 per person on health care. We spend half of that, yet we live longer lives. Our babies are born healthier, and our public health care system is the thing that defines us as Canadians. And when businesses are deciding whether they're going to locate in Canada, the United States, one of the things they look at is the employer premiums, healthcare premiums, much, much more affordable here in Canada. Let's see, this government is playing games with numbers. They continue to say, oh, we're investing $1 million here, $1 million there. But the fact is that they announced in the budget $7 billion in health care that they did not actually invest in our health care services last year. We have the lowest per capita spending on health care of any province in the country. We would have to invest another $12 billion just to reach the provincial average. And what happens is that people are not getting the services they need because this government's under an ideological campaign to privatize and Americanize our public health care system. And they are wasting our money. Today, the CCPA put out a report that they are spending $9.2 billion on private for-profit nursing agencies. There are private for-profit corporations performing surgeries at 3 times the rate in our public hospitals. So I'm asking the government to change course, to look at public health care as a competitive advantage, as a way to build our nation, and to stop using our healthcare system as a cash cow for private corporations, and to stop treating our Ontario patients as sacrificial lambs for corporate profits, and instead to rebuild public health care and our competitive advantage in this province. Thank you.
Further debate? I recognize the member from Ajax.
Thank you, Speaker. I appreciate the motion, the Opposition Day motion today from the NDP, as it talks about hospitals and healthcare as nation-building exercises. I agree; they absolutely can be nation-building exercises. Just because someone lives in Ontario, sometimes they may need to go somewhere else to get care in the country, or vice versa. We know that between different provinces that does happen from time to time. So 110%, I do think can be nation-building. And I appreciate that the NDP's identified healthcare issues, but in areas that are primarily, where we tend to see NDP representatives instead of other places in the province as well. When I look at, York Region, for example, or as the member from Ottawa South said, other areas of the province. So, while, okay, good motion, good start, I think it's important that we're also looking at the entire province. But we've seen over the last 7 years, and this is a Conservative government that ran on ending hallway health care. In fact, it's doubled. And that is a really, really big challenge for people in my riding. And it's something that I'm hearing about from constituents in my riding, not only just on the campaign trail, but afterwards as well. The emergency room department at Ajax Pickering Hospital, it's not, it's struggling under the pressure that our healthcare system is facing, and not just in Ajax and Durham region, but really all across Ontario. Right now, it's seeing about 15,000 additional visits per year, more than it was designed to handle. So when that hospital was originally built, it was built to handle about 20,000 visits a year. In 2009, under a previous Liberal government, I know members on the other side sometimes talk about, Liberals didn't do this or that. I mean, under a previous Liberal government, it was renovated to handle about 60,000 folks. And right now, the hospital in my riding in Ajax is seeing 75,000 visits per year. I hear stories of my constituents waiting more than 12 hours to be seen, 12 hours, even longer. Folks who are coming in with chest pains, folks who are coming in with other medical problems and issues that they're facing. That's something that I hear quite frequently in my community when I'm out and about. And our healthcare workers, they're doing their best. They really are, in my view, they are doing their best under what is a really, really, really challenging situation. And my constituents are worried. They're worried about what's going to happen to them if they need emergency care. So, ironically, on the day of the federal election, I was in my constituency office, and a woman came in to see me because she was dealing with a situation that involved her mother who's 94 years old. Her mother, who has been waiting in the emergency room department for over 3 days, set aside over in a hallway, but kind of at the end of the hallway, where she described to me, many other elderly patients as well. They were just kind of parked there until a room is available, until something opens up. So she came into my constituency office, understandably upset, understandably concerned about the well-being and the health of her mother. So she goes on to tell me, we've been taking shifts, sitting by her, helping her in the hospital, helping her with feeding, helping her in this situation that her mother's dealing with. But not every parent has, not every person who's in the hospital has a family support system who can be there in shifts, helping feed their parent, their loved one, the person who raised them. So that's something that I hear quite frequently, and it just so happened on that day I was in the constituency office, and she came in and needed somebody to talk to. So we've been helping her and working with her. But I had to be honest. It's the current situation. Frankly, it's not good enough. It's not good enough for my constituent who came in to see me. Her mother, 94 years old, out off in the hallway. And I followed up with my constituent, and I asked her, so what's happened since? So after a lot of pushing, after 3 days and 6 hours, what they did in the hospital is they had to open up a different extra little room that wasn't really equipped as a room typically where you would have patients, and they transferred her into there in a gym essentially with 4 beds. There's no call buttons. I was told a little bell. You need help, a little bell, like you would see in probably 1900. But this is today. This is 2025, and this is the state of our healthcare system in Ontario because more funding is needed in our healthcare system, Speaker. And I heard the member opposite speak about Durham Region. That's an actual story from Durham Region that's taking place right now. And I'll say this, we have not seen specific commitments on improving the Ajax Pickering Hospital Emergency Department capacity. And more recently, we saw how this government ended up fighting with the Mayor of Whitby, ended up fighting with folks in Whitby who were advocating and standing up to get a new hospital there. And it was only after public pressure, it was only after community pressure of more than 4,000 people signing petitions, advocating, that pushed this government to say, a little bit more. But what we've seen time and time again, it's a day late and $1 short. So my belief is that this government should be doing a lot more right now. I think the Opposition Day motion helps move it in that direction, but in my view, quite frankly, not far enough. So we need to see action taking place. Thank you, Speaker.
Further debate? Further debate? I recognize the member from Nickel Belt.
Thank you so much, Speaker. And I'd like to talk a little bit about Health Sciences North, which is the name of the hospital in Sudbury. It's a hospital, we call it the heartbeat of regional healthcare. It serves more than 569,000 people on over 300,000 square kilometer. It is a lifeline for 23 small healthcare facilities in our region that all refer to Health Sciences North for secondary and tertiary care. They have a lot of learners, close to 3,000, 2,900 learners every year, and they were named the best cancer treatment center out of the 14 cancer treatment center in Ontario. For sure. But as many northern and rural Ontario have unique healthcare challenges, people in Northern Ontario have poorer health outcomes. The rate of addiction and related death is way higher than anywhere else in our province. We have a lot of underserved children and youth population. Did you know, Speaker, that on an average day, the hospital will have 130 patients in what they call unconventional bed space. When you go to Health Sciences North, there isn't a corner that hasn't got a bed and somebody admitted into it. Think about it. You are sick enough to be admitted in a hospital, and 130 of those people sick enough to be in the hospital will be in a hallway, in a TV hall. Some of them are even downstairs, very close to the morgue. It just grosses me out. The hospital needs expansion. We had 4 hospitals in Sudbury. You remember Mike Harris, the health restructuring. We went down to 1. It was too small. They have been waiting for money for expansions for decades. Apparently it takes 15 years to build a mine. It takes over 20 years to build an addition to an existing hospital. Health Sciences North cannot wait any longer. Let's make sure that we get the number of beds that are needed to care for the people of the North. That means funding Health Sciences North. Thank you.
Further debate? I recognize the member from Beaches East York.
Yeah.
Thank
Beautiful Beaches East York, yes. Happy to be here to represent my glorious riding. Good afternoon, everyone, and thank you to my colleagues for bringing forth this Opposition Day motion. Today, I'll be taking my time to showcase magnificent Michael Garron Hospital in beautiful Beaches East York. For over 90 years, Michael Garron Hospital has delivered quality and crucial care to more than 400,000 people from over 20 distinct neighborhoods. From a hardworking and determined emergency department to specialized cardiology and neurology services, to youth mental health treatment, to innovative research projects focused on improving health care and access for community members, to its exemplary response to COVID-19, which ended up being a role model for community outreach citywide and actually right across the province. Michael Garron Hospital is a staple institution in our tapestry of communities. Michael Garron Hospital is responsible for one of the fastest growing emergency departments in the Greater Toronto Region, constituting the second highest growth rate amongst hospitals in the region. Despite being designed to see only 60,000 people per year, its emergency department volume has exceeded 100,000 patients annually. Consequently, Michael Garron Emergencies Department operates in surge capacity for nearly 3/4 of the year. Can you imagine? Ensuring almost double the amount of planned patients are provided with excellent care for nearly 9 months. Think about the nurses and healthcare workers who are already underpaid, overworked, and neglected, having to work in unsafe conditions every day because they are answering their community's calls for help. And this figure is slated to only get worse. with major residential densification projects estimating more than 135,000 influx of residents to East Toronto over the course of the next 5 years. This government has not listened to the calls for investing in Michael Garron Hospital. The calls from constituents, community organizations, and politicians alike, including yours truly. I have asked about this support in both verbal and written questions in this chamber and have only received weaker than weak responses from the Minister of Health. The first phase of Michael Garron's redevelopment, the new Thompson Centre, opened in 2023. It is glorious, but inpatient capacity did not increase. Michael Garron Hospital requires approval of Phase 2 of its hospital campus redevelopment. This project encompasses the replacement of critical acute care services, including operating rooms, adult and newborn critical care units, birthing units, cardiac inpatient units, and the emergency department. They are once again being innovative by operating the hospital while growing and redeveloping its footprint, all on its current location. But they are in desperate need of sign-off by this government, as Phase 2 will take years and years to build, and we have no time to wait. So I'm happy to support this Opposition Day motion. I'd love for Michael Garron to be added to the list. Thank you.
Further debate? Further debate? Now is the member from Sudbury. Niagara Centre. Apologies.
Thanks, Speaker. In my riding, the Welland Hospital is in urgent need of modernization, and a rebuild is part of the current hospital plan. But to even begin this process, Niagara Health requires a planning grant. Despite repeated requests for this pre-capital grant, final approval has not been given, and this has created anxiety in our community about the future of the Welland Hospital, a hospital my predecessor, Cindy Forster, had to fight to keep open at all under a previous Liberal government. Good job. This motion is an opportunity to get this project moving forward. From 2020 to 2024, Welland's population grew from 57 to 64,000, and the hospital's full catchment area is growing just as quickly as the population ages. Given the growth in Niagara's aging population, one of the highest concentrations of seniors in the entire country, it's imperative that we rebuild a full-service hospital in Welland and prevent the closure of the Urgent Care Centre in Port Colborne. Residents in South Niagara deserve equitable access to health care and hospital care, including emergency services. Using the name South Niagara to describe a hospital in Niagara Falls does nothing for the people of South Niagara who want healthcare services close to home. And Speaker, we all know that investing in hospital infrastructure at this uncertain time will mean good-paying jobs in the skilled trades for carpenters, electricians, and many others, as well as economic spin-off effects for communities like Niagara all across Ontario. We need a new, modern, full-service hospital in the City of Welland. I urge the government to get on board with this important motion so that my constituents can have confidence in the future of healthcare in Niagara and across Ontario. Thank you.
I recognize the member from Kingston and the Islands.
Thank you, Speaker. Hospital infrastructure is vital infrastructure, but I'm disappointed that there's a long list of hospitals in this Opposition Day motion from the NDP, but Kingston is not mentioned in the motion. Kingston General Hospital, the main building, is 190 years old. And the Kingston Health Sciences Centre has been planning what they call the Phase 2 redevelopment since 2015. The first plan, which involved building a new tower, was stopped by Infrastructure Ontario in December 2023. They're working on a different plan now for vital renovations and modernizations. Kingston Health Sciences Centre is a tertiary care academic health sciences centre. It's critical hospital infrastructure for southeastern Ontario. So I'm disappointed it's not part of this long list on the NDP Opposition Day motion. Thank you, Speaker.
Further debate? I recognize the member from Kiiwetinoong.
Speaker, when we talk about hospital infrastructure, I think one of the things that we need to understand and talk about is the social determinants of health. I know that in Kiiwetinoong, the current approach to hospital infrastructure perpetuates a sickness system in the north. And it only reacts to the health of the people living in the north when we are sick, and instead of preventing healthcare crises in the first place. I know that in Kiiwetinoong, First Nations communities are directly impacted by the social determinants of health, including Indigenous determinant to health. To name a few, it'd be colonialism, racism, poor housing conditions, experiencing disability, gender-based violence, and the lack of clean drinking water. There's so many examples that we can share in the north. Sulakot Miniawan Health Center, long-term care facility, Weegwas Elder Center, and Kenora. Those are some of the issues that we face. But again, if the government wants to move from a sickness system to a healthcare system for all of Ontario, they must start investing in healthcare infrastructure with the social determinants of health in mind. Miigwech.
Further debate? I recognize the member from Orleans.
Merci, Madame la Présidente. Cette motion semble dénumérer tous les hôpitaux que le NPD veut améliorer et ou agrandir. Il est certain, Madame la Présidente, que l'infrastructure hospitalière est importante pour bâtir une nation, pour bâtir un Canada plus fort. Malheureusement, mais pas peut-être très choquant, le NPD, comme le gouvernement, ignore les besoins de l'Est de l'Ontario et ceux de les communautés franco-ontariennes. Nos communautés franco-ontariennes ont également besoin d'infrastructures médicales. Comme plusieurs communautés en Ontario, elles sont mal desservies avec les longs délais d'attente dans les salles d'urgence. Comment le NPD peut-il parler d'infrastructures de construction nationale tout en excluant les soins de santé et l'infrastructure pour nos communautés franco-ontariennes? Comment? Aucune mention de la communauté franco-ontarienne dans votre motion. Renouveler la fierté des Canadiens et la valeur de notre système de santé universel d'un océan à l'autre contribuerait grandement à bâtir un Canada plus fort. Mais cela ne peut être pas réalisé si le NPD ou même le gouvernement oublie nos communautés franco-ontariennes. Reconnaître la valeur et l'importance de nos communautés franco-ontariennes est essentiel pour bâtir la fierté nationale et un Canada plus fort. Madam Speaker, how can the NDP expect to build nation-building healthcare from one part of Ontario to the next, from one part of Canada to the next, if they ignore Franco-Ontarian communities in Eastern Ontario? These communities are underserviced by healthcare services at the moment. They see enormous delays in emergency rooms, and it seems to me that the NDP have gone out of their way to ignore mentioning Franco-Ontarian communities in Eastern Ontario. Thank you, Madam Speaker.
The member from the PN.
Speaker, the Queensway Carleton Hospital is a jewel of Ottawa West Nepean, and I know the residents are incredibly proud of the high-quality health care that we receive, the excellent doctors, nurses, and healthcare workers that work there every day. But the hospital is just not the right size for the population that it serves, and so I regularly hear heart-wrenching stories about the kinds of waits that people endure, particularly in the emergency department. I spoke with one person whose mother had a pulmonary embolism, and they waited 13 hours in the Queensway Carleton. And a pulmonary embolism is not only very dangerous, it's very painful. And imagine sitting there in that kind of pain, knowing that you are waiting because there's other people who have more urgent problems than a pulmonary embolism. It's incredible that this is happening, Speaker. I also spoke to someone who thought they were having a heart attack 10 hours before they were seen by a doctor. This shouldn't be happening in Ontario. The Queensway Carleton has a plan to double the size of the hospital, double the size of the emergency room. They're ready to put shovels in the ground now if the government would just commit the funding. The people in Ottawa do not need a $100 billion fantasy tunnel under the City of Toronto. They need timely access to health care in their own community. I urge government members to vote for this motion to support the rights of people in Ottawa to access timely health care, and I especially encourage the members from Carleton and Renfrew, Nipissing, Pembroke, whose constituents use this hospital all the time to support this motion. Thank you, Speaker.
I recognize the member from Muskoweka.
Okay. You want to go first? Okay, I'll go first. You can go first. You can stand up. They'll recognize you.
We're proud of our motion.
That's ticking.
The member?
From Mushkegowuk, James Bay. Merci, Madame la Présidente. C'est drôle quand j'entendais le député d'Ottawa qui nous fait la morale sur les services en français. Quand ils ont été plus de 15 ans au pouvoir, ça fait combien d'années qu'ils sont 2 années sans... 2 gouvernements consécutifs qui n'ont même pas été un gouvernement reconnu, un parti reconnu. Puis là, maintenant qu'ils sont reconnus, ils se pètent les bretelles. On n'a pas de leçon à prendre de vous, messieurs les libéraux. Mais ça, je suis dit, ça me donne la chance de parler de notre système obstétrique dans le Nord. Tu sais, parce que notre motion en parle, puis on veut défendre les droits, mais il y a une réalité que le gouvernement doit voir quand on parle d'obstétrique dans le Nord. En 2023, à Hearst, le département d'obstétrique est fermé. Ça veut dire que les femmes qui vont avoir des bébés, qui attendent des bébés, doivent aller soit à Thunder Bay, soit à Sudbury ou à Ottawa, où il y a de la famille, sont obligés de se déplacer à 37 semaines. Moi, à Noël, je viens d'apprendre que ma fille va avoir un bébé, notre premier petit bébé. Je vais être grand-père pour la première fois. Mais je suis chanceux, mais même à travers ça, je suis chanceux, puisque moi, ma fille, vu qu'elle reste à Val-Côté, qui est à peut-être 20 minutes de Hearst, bien, elle peut venir à Cap. Où est-ce que Cap, il y a un système d'obstétrie, mais notre système d'obstétrie est financé, oui, pas tout à fait comme qu'il devrait l'être, qui la met souvent en danger. Fait que je pense que c'est important qu'on doit faire beaucoup mieux. On doit financer nos systèmes d'obstétrie, nos hôpitaux dans le Nord, pour ne pas mettre la vie des enfants en danger, surtout avec nos routes qu'on connaît dans le Nord. Merci, Mme la Présidente.
I recognize the member from Don Valley East.
Thank you very much, Madam Speaker. I'm pleased to rise in this chamber to address the Opposition Day motion before us, which very briefly seeks to urge the government to designate hospital infrastructure projects as nation-building projects and therefore fast-track us for federal funding. And I can't say that, I must admit that this motion and this call for action couldn't come at a more important time. At a time when our healthcare system under this government faces its worst performance in Ontario's history. We're seeing ER closures that now number in the thousands. We're seeing code zeros, a phenomenon during which patients call 911, but there's no ambulance available to meet them. Ambulance offload times, the amount of time it takes from a patient to be transfer of care from a patient, from a paramedic crew to an emergency department, higher than it's ever been before. Alternate level of care rates in our hospitals, higher than it's ever been before. We have more people who are paying for health care than ever before. We've just learned that recently $62 million has been spent for med checks through Shoppers Drug Mart, considered to be an abuse of our public health care system. We're seeing $9 billion spent on temporary for-profit nursing agencies. We're seeing home care falling apart. We're seeing hallway health care at absolutely astronomical levels. I was just working in the emergency department in my hospital yesterday, and believe it or not, our medical short stay unit is now in a public lobby. That wasn't the case in 2018. Nothing even close to that 7 years ago. But under this government, all we have seen is our healthcare system deteriorate. And so in the wake of all of these failures under the current government, of course, I would support a motion such as this one that seeks to increase funding associated with our healthcare system and specifically with our hospitals. But I will argue that this is actually a bit of a wasted opportunity and that there are certain premises in this motion that I find difficult to agree with. The first of which is that we are in this situation because of a past Liberal government. I would point out, under the previous government, we built hospitals, redeveloped hospitals, invented the first nurse practitioner-led clinics, the first family health teams, had the lowest ER wait times in the province's history, and then this government came along. So I have difficulty accepting that premise of this motion. I will also say that this motion misses important opportunities to fight for the right thing in our healthcare system. Now, what I'm going to say, I make in the spirit of trying to improve our healthcare system and make this motion as strong as we actually can make it. One of the biases that I find this motion perpetuates is that this preoccupation that our healthcare system equates to our hospitals and our acute care. That is the most expensive form of healthcare, the kind of healthcare that people resort to when they have no choice because they are already experiencing severe illness. A proper healthcare is founded upon primary care, home care, long-term care, community care, none of which is mentioned here. A proper healthcare system doesn't just preoccupy itself with bricks and mortar, unless it is a healthcare plan that is put together by this government. This government consistently focuses on concrete and beds without focusing on the workers and the staff that are necessary in order to make those hospitals and beds actually work for the people of Ontario. And so I worry that the foundation of our healthcare system, the most important part of our healthcare system, is left completely unaddressed. And finally, I will reiterate what my colleague just mentioned, which is, while no one can disagree with the fact that our hospitals do need more funding, I worry that I see no mention of our Francophone hospitals and the elements of our healthcare system that serve our Francophone community. One additional point that I will make is that while you could make the argument, and it's hard to find it offensive, you could make the argument that hospitals should be a nation-building priority of this government. I will point out that Prime Minister Carney has already designated at least $4 billion for the construction of hospitals. And so this is an opportunity not just to call for funding for hospitals, which is already being promised, but to fight for the other things that we desperately need in our healthcare system here in Ontario. To fight for funding for primary care, home care, community care, long-term care, and support for our healthcare workers, none of which, regrettably, is mentioned in this legislation. That being said, I will return to a point that I made at the beginning of my remarks, which is that, of course, hospitals could use more funding. I'll point to one of the big hospitals that serves my riding in Don Valley East. That would be Michael Garron Hospital. I have heard repeatedly during question period the Minister of Infrastructure comment on the funding that this government purports to have provided to this hospital serving my community. And yet what she chooses to ignore and to gloss over is every request for Phase 2 funding for their Project Imagine, which would actually be a project that increases the number of beds, because any projects up to now have not resulted in any net new beds. Our funding requests to actually create net new beds through the Phase 2 Project Imagine proposal have been rejected by this government. And it's hard for me, though I will, it's hard for me to support this motion without pointing out the fact that one of the fastest growing ridings in the province does not have its major hospital mentioned in it, and I would call for that if we ever had an opportunity for amendments. I've seen firsthand the challenges that our hospitals faced. At Michael Garron Hospital, I mentioned already, the medical short stay unit is now in a public lobby. The emergency department, built for 60,000 people, now serves over 100,000 people. I've worked at Winnebago General Hospital in Mushkegowuk, James Bay, an old hospital in desperate need of replacement, urgently, and not just in desperate need of funding for replacing that hospital, but for the training of its healthcare workers, for the hiring of its healthcare workers, and for the support of all of the nursing stations that feed patients into the central location. Of course, I support the reopening of the Minden Emergency Department. Have been there at least on 3 separate occasions. Understand how the people of the Minden community and surrounding area are being robbed of the vital, what we call golden hour in emergency medicine and critical care. The golden hour during which the right intervention, the right treatment with the right people in the right place can mean the difference between life and death. And for those people who reside in and around Minden, who will no longer be able to access emergency and specifically critical care within that golden hour, those all-important 60 minutes, I cannot speak to the importance of them having their emergency department restored, and not just restored, but restored to 24-hour, 7 days a week service, not just banker's hours. Just last week during question period, we heard my amazing colleague from Nepean speak to the challenges that are being faced at Queensway Carleton. He's a nurse. He's there propping up the healthcare system and that hospital against the odds. We had the Minister of Health have the audacity to attack a healthcare worker and say that he was denigrating the own hospital that he works at. We need a culture of respect, of listening to experts, and not just of building hospitals, but supporting our healthcare workers, like the one behind me who is trying to fight for his community and was talked down to by the Minister of Health. In closing, Madam Speaker, the current situation in Ontario is untenable. The government's mismanagement of healthcare in Ontario is untenable. More funds are required. More hospitals and infrastructure are required. But more support for healthcare workers is required. The preoccupation with healthcare worker recruitment has to be balanced with an equal preoccupation with healthcare worker retention. Only if we can address all of these things, which are not fully captured in this motion, only if we can capture all of these things can we build and strive towards the healthcare system that all Ontarians deserve. I will support this motion, though I point out that there are many missed opportunities to make it as strong as our province deserves. Thank you.
The member for Scarborough Southwest.
Thank you very much, Speaker. Speaker, we know too well the pain visiting an ER room, waiting for hours and hours, or worse, taking a loved one who's in excruciating pain and waiting for hours. I've visited hospitals with portable clinics in the driveway of the hospital, and we heard about Michael Garron Hospital. We have also seen staff use storage rooms just so they can make space for beds in hospitals as well. We also know the shortage of staff in hospitals where ER rooms had to be closed down during crisis, and imagine shutting the doors to a patient. Hours of wait, months and months or years for waiting for surgeries or appointments, all of which are costing this province money, but also costing lives, Speaker. Meanwhile, Ontario actually spends the lowest per capita funding when it comes to our healthcare. And this is a legacy that the Conservative government actually carried on from the Liberals. In 2015, 2016, 2017, we saw some of the lowest per capita funding to healthcare in the province, in this country actually, that this province had. And so it's the years and years of neglect to our healthcare system that has costed us where we are right now, the healthcare crisis that we're facing, the aging buildings, the shortage in staff. So I know truth hurts. Truth hurts for both sides. Speaker, this morning the CCPA revealed that over $9 billion of taxpayers' fundings were actually going to private agencies, nursing agencies, private agencies for profit. Not to the nurses, the agency, Speaker. That's what's happening right now. That's not nation building, especially at a time when we're facing economic crisis, when we should be strengthening our province. So today we have a solution. We have a solution to build this province, build this country. That's the nation building plan, to make sure that we are building hospitals, we're providing the support they need, and make sure that we actually have the people in those hospitals as well. That's our plan, Speaker, and we're creating jobs. Thank you very much.
Further debate? Further debate? I recognize the member from St. Catharines.
Thank you, Speaker. I rise today on behalf of the residents of St. Catharines to address the urgent issue of hospital infrastructure and the state of our healthcare system. The Murata Family Hospital in St. Catharines is at a breaking point. Residents are waiting up to 18 hours in the ER department. When this hospital was built, residents were promised a mental health wing, staffed and open 24/7. The reality is we lack the staffing infrastructure to open this wing. People in crisis are being directed to the emergency rooms instead of having dedicated support in place. Hospital infrastructure is not a luxury, it's a lifeline. In St. Catharines, we are seeing firsthand the consequences of years of neglect, of funding shortfalls, overcrowded emergency rooms, aging buildings, and staff stretched to the max. Yet infrastructure proposals that would provide relief and modernization have been stalled or shelved under successive Liberal and Conservative government. Investing in hospital means investing in people, Speaker. It creates space to retain and recruit desperately needed healthcare workers, from nurses and PSWs to specialists, who have formed the backbone of our public system and make it easier for residents to get care they need. We are in a healthcare crisis. If we want to build a stronger, more resilient system, our hospitals must be a top priority. Not next year, not this year, now, right now. For hospitals, parking, fees, to MRI wait lists, Ontarians are being forced to pay the price. That's why I'm calling on this government to designate critical hospital infrastructure as a priority in the 2025 budget. Show our frontline workers in Ontario that their health and safety comes first, that our aging population in St. Catharines and across Niagara can access quality care they've paid for for the past decades. People deserve a government that puts healthcare first, not one that pushes off their responsibility while patting themselves on the back for further infrastructure priorities. You have an opportunity to get this right and support this critical common sense motion.
Further debate? I recognize the member from Ottawa Centre.
Thank you, Speaker. I'd like to just point out to the redevelopment of the Ottawa Hospital Civic Campus, which was meant to be a transformative project, a long overdue investment to replace an aging facility and improve healthcare for residents from across the region. However, this project has become a textbook example of mismanagement, misguided priorities, and the downsides, again, of privatization. The decision to use a P3 model has already led to significant delays and escalating costs. Originally projected to cost $2.8 billion, with construction set to begin in 2024, the project is now delayed until at least the end of 2025, with costs now under review. This P3 model has failed to deliver on its promises. Instead of investing in the hospital itself, the government has pushed the costs of infrastructure onto local municipalities, asking the City of Ottawa to contribute $150 million of the $700 million local share, while the rest is expected to come from fundraising. But as construction costs rise and projects like a parking garage swallow more of the budget, we have to ask, where is the money for patient care? Every dollar spent on P3 delays is a dollar not being used for frontline staff, specialized equipment, expanded emergency services, and the 641 single-patient rooms this hospital was supposed to deliver. Ontarians deserve a government that listens to people, invests in public services, and makes decisions that benefit everyone, not just the bottom line. Thank you, Speaker.
I recognize the member for Sudbury.
Thank you very much, Speaker. I want to start by thanking the nurses. It is Nursing Week after all. Absolutely. As we know, nurses have been short-staffed, affected by Bill 124. They're subject to workplace violence, and a lot of that will be alleviated with funding. Getting to the motion, though, on infrastructure and extending infrastructure in hospitals, Health Science North in Sudbury was amalgamated by the Harris government and was built too small. And so now we have dozens of off-site places for a one-site hospital, which is broken. The investment into this organization would mean that we would put good tradespeople to work, we'd drive the economy, and we have a hospital large enough to accommodate people. Sadly, I was elected in 2018 because the Liberal government had created Health Science North as the foundation and the boilerplate of hallway medicines now spread across the province. The Conservatives have failed to address this, but they could if they would invest in our hospitals, invest in our nurses, and our health care. Thank you, Speaker.
Further debate? I recognize the member from Waterloo.
Well, thank you very much, Madam Speaker. And I just came from the Empire Club, where the Finance Minister was talking about how we need bold projects, nation-building projects to stabilize the economy as we move through this really economic uncertainty as a province and also as a nation. So we think, though, on this side of the House, that being bold means having safe hospitals, having accessible hospitals, having well-resourced and well-staffed hospitals. In our mind, that is a very bold plan. Also, Madam Speaker, the list of hospitals that are contained within the motion would also stimulate those local economies for the skilled trades. You can't outsource those jobs when you're building to protect Ontario. Finally, on this point, is that when investors, when capital is looking to go someplace and move into another jurisdiction, they are looking for that social infrastructure. They are looking for the strong schools. But healthcare is the #1 issue that attracts people into the province of Ontario, and they are not impressed with what they're seeing. Right? I just had surgery last Monday. I got great care in the hospital, but the hospital itself, the infrastructure, is failing people, and the people who work within that system feel it too. So let's support those good people who are doing strong healthcare practices across our communities. Let's support the innovation in those communities by investing strategically, by ensuring that every community has access to health care and that we, as legislators, are supporting those good people. This is smart investment, Madam Speaker. It is, in fact, very bold. I encourage everybody to support this.
Further debate?
Thank you, Speaker. You know, we in the government benches have grown so accustomed to the NDP being opposed to building things in Ontario that it was a breath of fresh air when I read this motion that the NDP finally decided to build one thing in Ontario, because they're so against building everything else. They're against building highways. That's why they're against building Highway 413, and they're against building tunnels. That's why they don't want a tunnel under the 401. They're against building mines. That's why they voted against the Building More Mines Act. They're against building signature provincial recreation projects. That's why they don't want to redevelop Ontario Place. They're against building roads. That's why they love bike lanes. And they're against building homes because they want the government to put everybody else out of business and have the government build homes. But finally, Madam Speaker, finally the NDP have decided that they're in favor of building one thing. They're in favor of building hospitals. And that's a breath of fresh air, I think. I think we can all agree with that. And of course, they probably don't want to move too fast on building those hospitals, right? First they'll want to do 15 years of environmental studies and then another 15 years of consultation, and then 30 years from now they might eventually get around to maybe tendering one of those hospitals, because you can't expect the NDP to move too fast. Well, we've got to jump on them, Madam Speaker, because while they were deciding whether or not they wanted to actually build anything in Ontario, we actually have 17 major capital hospital projects already under construction in the province of Ontario while the NDP were asleep at the switch. Here are some of those capital projects. In Brantford, we have the Emergency Department Expansion Project for Brant Community Health Care System. In Cambridge, we have the main capital redevelopment project at Cambridge Memorial Hospital. In Toronto, we have a redevelopment of the Centre for Addiction and Mental Health. In Grimsby, under construction, West Lincoln Memorial Hospital redevelopment project through the Hamilton Health Sciences Corporation. In Toronto, phase 1 of a new patient care tower for the Michael Garron Hospital. In Niagara Falls, at the new South Niagara Hospital Capital Project through the Niagara Health System. In Picton, we have the Prince Edward County Memorial Hospital redevelopment for Quinte Health. In Scarborough, Centenary Site new dialysis unit for the Scarborough Health Network. Also in Scarborough, diagnostic imaging fit-up for the Diagnostic Imaging Concourse at the Scarborough Health Network. Also in Scarborough, at the general site, hemodialysis isolation unit through the Scarborough Health Network. In Toronto, off-site and on-site dialysis center through Sunnybrook Health Sciences Centre. Also in Toronto, Provincial Mental Health and Addictions Capacity Brain Sciences Centre project through Sunnybrook Health Sciences Centre. In Thunder Bay, the cardiovascular surgery program through Thunder Bay Regional Health Sciences Centre. In Toronto, patient care tower through Unity Health Toronto St. Michael's Hospital. Also in Toronto, stem cell transplant phase 2 expansion Head Start project through the University Health Network. Also in Toronto, the new Toronto Western Hospital Tower through University Health Network, and through and in Moose Factory, Moosonee, new replacement hospital at the Wee-Nee-Baco Area Health Authority. 17 capital projects currently underway, and that's just the ones that are underway. I haven't included any of the ones that are in the planning stage or in the tender stage or in the land acquisition stage. Those are just the ones that are currently under construction. I could go on and list a whole lot of other projects that are in the planning stage and in the tendering stage, but the list would be so long that I think a lot of members of the Liberal Party would reach retirement age before I got to the end of the list. Now remember, it was the Liberal government that promised to build a new hospital in the greater Essex region, right? It was the Liberal government that promised to do that, and then they reneged on that promise, and it was the current Premier who picked up that promise, and now that project is in phase 3. We've already gone through the first phase. We've acquired the land. There was the land acquisition phase. We acquired the land, and there was the second phase, which was the design phase. That's done. Now we're in phase 3, the tendering of the project for the new regional hospital in the greater Essex region, a project that was promised by the Liberals. They reneged, and this government had to fulfill that promise. So this motion, by the way, is far too late. Now, if you want to hear more about that project that I just talked about in the greater Essex region, you should buy the member from Windsor Tecumseh a coffee, because he has a lot more to tell you. He could tell you, for example, how there were certain activists and locally known NDP and Liberal activists who actively campaigned to block that hospital. And he will tell you all the details. He's intimately informed about that, and he'd be happy to tell you all about it for the price of a coffee. So this motion, although it's a pleasant motion to build something in Ontario, comes far too late. What the NDP should have done is they should have brought this motion 15 years ago to get the Liberal government of the day moving to build something, because if they had built something in Ontario, then we wouldn't have so many capital projects that have fallen, so far behind in the province of Ontario that the present Premier now has to make up ground for. Also, the NDP should have brought this far earlier than now, because we already have 50 capital projects underway in the province of Ontario, many of which are already under construction. But it's nice to see that the NDP have finally decided that there is just one thing they want to build in the province of Ontario. Thank you, Speaker.
Further debate? Further debate? The Leader of His Majesty's Loyal Opposition.
Thank you, Speaker. Thank you. I was listening very carefully to some of the comments made by others, and it sounded to me like we might have the support of all parties here. I certainly hope so, as so many of you spoke in such glowing terms about the motion and everything that we could be doing together here. And at the end of the day, this motion is about delivering health care and a health care system that people were promised. Making sure that it's actually funded in the 2025 budget. I know that's what we're all looking for. It's about getting shovels in the ground, creating good union jobs, and giving families all across this beautiful province the peace of mind that care will be there when and where they need it. Those are not far-off dreams, right? These are shovel-ready projects, some of them. Some of them have been long planned, long promised, and of course, in many cases, long overdue. People in Brampton shouldn't have to be kept waiting. Families in Welland and Windsor in the north, they've been more than patient. And as you see, Speaker, we've included a lot of projects in the language of the motion, but hey, let's build more. Let's get it done, right? But they need a government that works and a government that delivers. Speaker, this is a test of priorities. If the Premier wants to invest in nation-building infrastructure, as he says he does, he should start here. Build hospitals, expand urgent care, reopen our emergency rooms. Because if this government is serious about strengthening Ontario, then these projects must be funded in this year's budget. And that's what we're going to be looking for. Whether this government decides to support this motion, and I can't see why they wouldn't, but if they decide not to, then we want to see it in the budget. Let's wait, let's see what they're going to do in the budget. Let's go. Let's stop delaying. Let's stop pretending that these are not urgent issues and urgent projects. Let's build care. Let's strengthen Ontario. Let's get the job finally done. Thank you, Speaker.
Ms. Stiles has moved Opposition Day motion number 3. Is it the pleasure of the House that the motion carry? All those in favour of the motion will please say aye. Aye. All those opposed to the motion will please say nay. Nay. In my opinion, the nays have it. Call in the members. There will be a 10-minute bell. Member Order. Order. Ms. Stiles moved Opposition Day motion number 3. All those in favor of the motion will please rise one at a time and be recognized by the clerk.
MPP Stiles.
MPP Stiles.
MPP Tavis.
MPP Tavis.
Ms. Sattler.
Ms. Sattler.
Mr. Vanta.
Mr. Vanta.
Mr. Mamakwa.
Mr. Mamakwa.
Ms. Bagan.
Ms. Bagan.
MPP French.
MPP French.
Mr. Birch.
Mr. Birch.
Ms. Fife.
Ms. Fife.
MPP Bell.
MPP Bell.
MPP Pasma.
MPP Pasma.
MPP West.
MPP West.
MPP Kernahan.
MPP Kernahan.
Deputy Jelena.
Deputy Jelena.
Miss Armstrong.
Miss Armstrong.
Mr. Okosovic.
Mr. Okosovic.
MPP Bourgeois.
MPP Bourgeois.
MPP Wong Tam.
MPP Wong Tam.
MPP Gates.
MPP Gates.
MPP Shaw.
MPP Shaw.
Monsieur Bourgoin.
Monsieur Bourgoin.
MPP Stevens.
MPP Stevens.
MPP Glover.
MPP Glover.
MPP Lennox.
MPP Lennox.
MPP Gilmore.
MPP Gilmore.
MPP McKenney.
MPP McKenney.
Mr. Fraser.
Mr. Fraser.
Madame Collard.
Madame Collard.
Mr. Shamji.
Mr. Shamji.
Mr. Blake.
Mr. Blake.
MPP Smythe.
MPP Smythe.
Ms. Bowman.
Ms. Bowman.
Ms. McMahon.
Ms. McMahon.
MPP Hazel.
MPP Hazel.
Mrs. McCrimmon.
Mrs. McCrimmon.
Mr. Sow.
Mr. Sow.
MPP Watt.
MPP Watt.
Mr. Surjanic.
Mr. Surjanic.
Ms. Fairclough.
Ms. Fairclough.
Ms. Clancy.
Ms. Clancy.
All those opposed to the motion will please rise one at a time and be recognized by the clerk.
Mr. Clark.
Mr. Clark.
Mr. Lecce.
Mr. Lecce.
Ms. Mulrooney.
Ms. Mulrooney.
Mr. Calandra.
Mr. Calandra.
Mr. Ford.
Mr. Ford.
Mr. Bethlen Falvey.
Mr. Bethlen Falvey.
Mr. Sarkari.
Mr. Sarkari.
Mr. Downey.
Mr. Downey.
Mr. Cho Scarborough
Mr.
North.
Cho Scarborough North.
Ms. Surma.
Ms. Surma.
Mr. Kersner.
Mr. Kersner.
Mr. Harris.
Mr. Harris.
Ms. Thompson.
Ms. Thompson.
Mr. Peary.
Mr. Peary.
Mr. Jones, Chatham,
Mr.
Kent,
Jones,
Leamington.
Chatham, Kent, Leamington.
Ms. Dunlop.
Ms. Dunlop.
Mr. McGregor.
Mr. McGregor.
Mr. Flagg.
Mr. Flagg.
Mr. Pacini.
Mr. Pacini.
Mrs. Tangri.
Mrs. Tangri.
Mr. Parsa.
Mr. Parsa.
Ms. Williams.
Ms. Williams.
Mr. Cho Willowdale.
Mr. Cho Willowdale.
Mr. Lumsden.
Mr. Lumsden.
Ms. Kandris.
Ms. Kandris.
Mr. Quinn.
Mr. Quinn.
Mr. McCarthy.
Mr. McCarthy.
Mr. Ray.
Mr. Ray.
Mr. Smith. Perry Samuskoka.
Mr. Smith, Perry Samuskoka.
Mr. Liardi.
Mr. Liardi.
Mr. Bailey.
Mr. Bailey.
Mr. Coe.
Mr. Coe.
Mr. Holland.
Mr. Holland.
Mr. Osterhoff.
Mr. Osterhoff.
MPP Hamid.
MPP Hamid.
Mr. Tani
Mr. Tani Gassi.
Mr. Sanders.
Mr. Sanders.
Ms. Smith Thornhill.
Ms. Smith Thornhill.
Mr. Pang.
Mr. Pang.
Mr. Babikian.
Mr. Babikian.
Ms. Dixon.
Ms. Dixon.
Mr. Hardiman.
Mr. Hardiman.
Mr. Sabawi.
Mr. Sabawi.
Mr. Kanapati.
Mr. Kanapati.
Ms. Gallagher Murphy.
Ms. Gallagher Murphy.
Mr. Smith Scarborough Centre.
Mr. Smith Scarborough Centre.
Mr. Riddell.
Mr. Riddell.
Mr. Pensino.
Mr. Pensino.
Mr. Sarazan.
Mr. Sarazan.
Mr. Graywall.
Mr. Graywall.
Mr. Dowie.
Mr. Downey.
Mrs. Y.
Mrs. Y.
Mr. Smith Peterborough Kawartha.
Mr. Smith Peterborough Kawartha.
Mr. Bauman.
Mr. Bauman.
Mr. Saunderson.
Mr. Saunderson.
Mr. Anand.
Mr. Anand.
Mr. Jordan.
Mr. Jordan.
Mr. Alsop.
Mr. Alsop.
Mrs. Cooper.
Mrs. Cooper.
MPP Vickers.
MPP Vickers.
MPP Siriello.
MPP Siriello.
MPP Ferret.
MPP Ferret.
MPP Scott Sault Marie.
MPP Scott Sault Marie.
Gaultieri.
MPP Gaultieri.
MPP DeRuse.
MPP DeRuse.
MPP Rosenberg.
MPP Rosenberg.
Mr. Rasinski.
Mr. Rasinski.
MPP Deneau.
MPP Deneau.
Mr. Shu.
Mr. Shu.
The ayes are 40, the nays are 69.
The ayes are 40, the nays are 69. I declare the motion lost. Orders of the day.